we thought there'd be more arrhythmias, and actually it turns out there are not as many as we thought. But what I do see, I've seen locally in my own practice and talking to my colleagues, is that patients, if they're going to have an arrhythmia as a secondary cause from COVID-19 pneumonia, is usually atrial fibrillation, and it's not the more dreaded like ventricular tachycardia or sudden cardiac death. However, if the patient has a really bad heart failure to begin with, right, the COVID-19 pneumonia can make things worse and make the heart failure worse, which secondary, which downstream causes more. It makes it more difficult to manage the heart failure because the patient is having more arrhythmias, whether it's VT or atrial fibrillation. But commonly, it's just atrial fibrillation that we're seeing in both young and old patients, and that's a good thing because it's easier to manage versus ventricular tachycardia or sudden death. Obviously, older patients tend to do poorly, right? But that being said, I just did a procedure this morning on a patient who is much younger, like in his 40s, and he had not Afib, but he had SVT, which is basically it's a cleaner form of a tachycardia coming from the top chambers of the heart, which is much more easily fixed than atrial fibrillation, for example. That particular patient got an ablation and he's now fixed. But in general, like older patients with comorbidities like hypertension, obesity, COPD, heart failure are the ones we see more with atrial fibrillation in the acute phase when they're really sick. And as they start getting better through the variety of treatments that we have, most of it which is supportive, oxygen, steroids, and whatnot, as the patient gets better, the arrhythmia goes away on its own, which is really good for the patient and also for us because it makes our life easier for a patient that's very complex to deal with to begin with. But Afib, usually older patients and comorbidities of heart failure, diabetes, hypertension tend to cluster more. Obviously, the sicker the patient is, the more predisposed they're going to be developing some sort of arrhythmia. I've had a patient as young as 35, and then patients, because of medical science, we're able to keep people around longer. So as old as 85, 88, I have a 85-year-old right now who in his acute phase was having a lot of atrial fibrillation. We just controlled the rapid rate, and as his condition improved, the Afib just went away without me doing much else, which is fantastic. And he never had Afib until he got hospitalized with COVID-19 pneumonia. The only thing that concerns me about the cold is people that go outside to shovel snow. It's not so much cardiac, it's orthopedic. I've done a lot of cardiac clearances for people with broken hips and femurs because they slipped and fell trying to do the right thing, which is shovel their own driveway. So that's the biggest concern. But the one thing, whether it's pandemic or not, COVID-19 or not, winter or not, is something that I think all cardiologists can agree on is diet and exercise. It's harder to take off the weight once you've put it on. And so, my patients almost unilaterally get, I wouldn't say orders, but suggestions to, hey, you guys have to watch what you eat and you have to exercise, some sort of meaningful movement. And a rough number I give them is, hey, 3 hours a week, spread it out. I don't care how you do it, just spread it out. If you are walking, then make sure you can't talk on your phone while you're walking because that's not effective exercise. And so that's what I've always recommend for all my patients is you need to watch what you eat. You need to eat healthy, heart healthy, and you need to exercise because if you don't have a heart problem, that prevents you from having one. And if you have one, it'll help your doctors manage it better because you're doing your part of the bargain to take care of yourself. But that's the main thing, the basics: diet, exercise, avoid smoking, avoid excessive alcohol.